Hello everyone, and welcome to this session about implementing impact interventions. The purpose of this session is to share with you some ideas we have to help coordinate intervention implementation across the LIPS. This has been developed by myself, Kathy Scott, Will Miller, Ginny Lewis, Gowan, and a lot of the LIP coordinators have had some input into it. So I thank everybody for the work that they've done to get us to this point, and look forward to continuing to learn with you about what's working and what's not, and improving our interventions as we go. A really important part of this conversation is recognizing that we don't know exactly how things will look 12 months from now. And a lot of what we do will be building this puzzle together. So before I talk specifically about the LIP intervention guide, I would like to talk with you about a couple of key concepts: complexity and learning and development, to set the foundation for supporting each of us as we develop the interventions that each LIP is looking forward to using within their communities. Starting with complexity, many of you have likely seen a version of this figure. In the bottom left, you can see the simple domain, where there's a high degree of certainty and a high degree of agreement on what needs to be done and how. In the middle, complex environments, where there's less certainty about what needs to be done and less agreement. And then in the upper right, the chaotic environments, where there's very, very low certainty and low agreement on what needs to be done. Much of what we're doing in our LIPS falls within the complex environment domain. In that domain, we aren't very certain about what needs to be done and how, and what needs to be done and how it's done will vary based on context. So in order to move through complex environments and to implement an intervention, it's very important that we embrace the understanding that we will be co-creating the methods and approaches that we use, and working together and learning together to manage our resources. In this domain, it's all about experimentation, dialogue, and co-creation. Now just a little bit about learning and development. Over many, many years, people have been developing approaches that better guide the way we learn within complex environments. And while there may be some debate about the percentages and some critique of the level of evidence that some of these models have within them, the most important thing is the principles that underlie them. And in the 70-20-10 model, which is one that's being increasingly adopted in human resource development circles, and similarly to the others in here, critiqued by researchers who don't believe there's enough evidence to say the number should be 70 or 20 or 10. What they're saying in principle about this model is that very little about what we learn and retain is learned through structured courses and programs. In this model, they say 10%. More is retained when we learn and develop through others. So getting feedback from our supervisors, getting some support from colleagues. But much of what we retain and use and is sustained over time in complex environments is learned through experience. So while we're presenting this guide to you, we know that there are limits of guides and manuals. And we know that we do not have all the answers to the things that you will face in your interventions. What we're doing with this guide is providing you with what is currently the leading evidence around implementation science, and really encouraging you once again to embrace this notion of co-creation and learning as you go. So the emphasis is strongly on learning alongside others and mobilizing existing capacity within your environments to ensure that we leave the lips when the lips end at the end of impact, that we've created something that is more strongly embedded in the community because we've learned with those with whom we're working. The purpose of the guide, as I've indicated, is just to provide an overview of current thinking on implementation, to provide guidelines for next steps, while knowing that each lip will adapt and reflect the unique circumstances of their context. There is no one right way to do this, but there are some guideposts along the way that can help. And for impact, it's very, very important, as we have done with just establishing the local innovation partnerships, it's very, very important to coordinate major developments across the lips so that when we move through this and enter into our evaluative work in a more rigorous way, we're able to compare across some of the key milestones that each lip should achieve. As I've said, and as you will see in the guide when we talk about it in more detail, we talk initially about implementation theory. There's a lot of great work that's being done in this area across the globe. Some of it is distilled into this language, which talks about competency drivers, organizational drivers, and leadership drivers. To this, we've added relational drivers, and we'll talk later in this session a bit more about each of those as we go through the implementation guide. The key thing to think about here is that it's important to continuously reflect on whether or not we have within the group that's doing the work that needs to be done the competencies required to move this work forward, whether the organizations involved in the work have the resources and assets in place to assist with the work, whether the people who are assisting in leading at multiple levels throughout this process have what they need and are sharing what they know in a way that really facilitates and catalyzes the action. And all of this is founded on the relationships we develop. Another figure for you, and this one you may have seen if you've had a chance to look at the initial draft of the developmental evaluation plan. This comes from work that's done in the area of collective impact and developmental evaluation. Two approaches that underpin in some aspects, in some ways, aspects of each of the lips. Collective impact is very basically what it says. Groups of people working together to ensure that the work that they do is directed towards having an impact that is more than the sum of its parts. It takes best advantage of all those who are collaborating to move a certain agenda forward. And developmental evaluation is an approach to evaluation that really focuses on learning and improvement as we go. So one of the unique features of developmental evaluation approach, which we will be adopting, is providing ongoing feedback to those who need it when they need it, in order to know whether they should make some course corrections as they implement their intervention. Again, we'll provide some resources for this, and we'll continue to talk about these concepts throughout the implementation process. So just basically, before we go into looking at the guide in a more comprehensive way, the stages that have been outlined in it draw from literature on design thinking, implementation science, and many other areas that were discussed in the early parts of the guide. So initially, and much of this work has been done in the local innovation partnerships, how are we planning for and designing the intervention? That's the question that's asked at this stage, and making sure that we're identifying the people within the communities that will have a stake in the intervention, both the organizations and the people who will be affected by the intervention, and engaging them in exploring ideas for the intervention and the ways in which it might be implemented, as well as beginning to look at resources available. The second stage, capacity and readiness assessment, is about looking at whether we have enough of the resources we need, whether we have a level of readiness among those that are involved to move things forward. Some of us are entering into that stage, and I want to emphasize as well that these stages are not step-by-step. They're more iterative than anything, and likely when you take one step forward, you might need to take a step back a stage in order to make sure, once you do your capacity and readiness assessment, that you expand your engagement potentially to include others that you didn't think of initially. So when you get to initial implementation, you've moved through all of that work, and you're adjusting and modifying what you thought might work based on the capacity and the readiness in the community. Now, when you've done that work, moving on to full implementation, you've set the stage as best you can, but you also know that once you start implementing, there may be some tweaks necessary to make sure it reflects the contextual realities that you face. Our goal is very much about sustainability and trying new things within a community to address age-old questions, to ensure that the needs of the populations that we're working with are best met. So all of the work up to this point is guided towards creating something that's sustainable. And in particular, those relationships that we develop with the community, with the organizations, and with the people who are receiving services will be instrumental, will be the foundation on which sustainability is achieved. So, as you've heard me say in a few different ways, this guide is just one tool to help us get towards successful implementation. We need to continue to support each other, and we will find ways to do that through our conversations, our online conversations, and strategies we build into each local innovation partnership to support learning as we go and improving. It is very much a guide, so additional assistance may be required to assist you. The checklists in the guide will be there and will be there and helpful to just looking at key elements that you should consider. But for each of these stages, the conversations that you have with others will likely take you that much further towards successful implementation. So now let's look at the guide in detail, and after that, if you have any questions, and throughout that process, if you have questions, we'll work through them together and improve what we're doing in that way. Just want to thank all of the sponsors for supporting this work. This is a group project, just getting to this stage, and will continue to be that as we move forward. Thank you very much.
Simone.
Hi, thank you, Kathy. And I'm not sure whether you intended to do this, but I think it'd be helpful for us to go through the tools just to sort of, get a sense. Of course, we can look at these on our own, but since we're here together, sort of the intent of each of the tool and give us examples. Is that something you intended to do?
Yeah, that's what this section is about. I thought I'd just pause, though, if there are any general questions, for sure.
Oh, no. Okay, I wasn't sure. Thank you. No general question. It's all clear.
Okay. And you didn't fall asleep with my monotone?
No, followed very well. We had to pay attention only because it was very low.
Yes. So, given that I'm not seeing any questions, and I don't know, Sarah, if you're able to know that better than I, there are no other questions, then we will go through the guide now in more detail.
There's no other questions.
Okay. Could you go up to the top of the guide, Sarah, and we'll just go through the first few pages, just so people know what this all looks like, and some of it, based on the presentation, will be familiar. So, as you can see here, we've divided it into a couple of sections. The first is an overview of implementation and the workbook in general. The second is an overview, and then going into more detail with each of the stages with a checklist attached to each. And as Sarah mentioned, this is just in time workbook development, so we have this at this stage. As of this morning, Sarah and Jen had worked on tidying up the checklists to make them look like checklists, and adding some comment sections. So very much a work in progress, and here for you to have a closer look at and provide feedback on. I also want to draw your attention to the appendices before we go into detail. We've tried to indicate, as you see in Appendix A, how the stages of implementation relate to existing theoretical frames that we're using in Impact, to the REAIM framework, given you some specifics around implementation drivers, which you may want to read more about on the NERN website, which is included here. And some of the feedback we had was that this sounds very much like an improvement process, improvement processes that are very well established in organizations. And you're right, it definitely does. What we're talking about in implementation, it draws from improvement for sure, and so we've included some overview of improvement processes in the third appendix for your reference. So Sarah, if we just go down now to the next page, the page that provides an overview of implementation science. And I just want to indicate here that implementation science is a field that people are talking a lot about these days. It's more a consolidation of a lot of work that's gone on in the past than anything frighteningly new. And so within implementation science, the different stages that we'll talk about draw on some key work, and initial stages, for example, draw on key work that's been done over many years and even decades in community development, participatory action, citizen engagement, communications, policy development, and political science. It's also got elements of social network theory. So again, very strong theoretical foundations to this, reframed to help us think differently about implementation of interventions as a whole. So we've just placed a spattering of the roots of implementation science here. Likely people could also insert more, but want you to know that it's not something that's been new to the landscape without strong foundation. And so on to the next page. Talked about this a little bit in the presentation. This is something that we've had inserted into the plan for developmental evaluation, and we'll talk more about that in separate sessions over the fall and separate opportunities to talk about developmental evaluation. But the idea with that is to just be clear that we're in, back up one page, Sarah, sorry.
Sorry.
That's okay, right there. So on the we're in the early years of impact, and those early years in this model, in this framework, really are about designing for impact and implementation. And at that stage of the process, a developmental evaluation approach is quite often informative to help feedback as we learn to inform changes in design and implementation approaches. And that's very much how we're nesting this link between the interventions and the implementation of those and the developmental evaluation work that is moving forward. I also wanted to emphasize, too, that throughout this workbook we try to tie it back to the other projects within Impact that are guiding the intervention work. And in particular, at this stage, Project 2 and the work of the Realist Review is really helping to guide the logic models and helping us to think more deeply about the core components of our interventions, and has been quite helpful. This is speaking from our Alberta LIP perspective. So on now to the stages. And you saw this overview in the presentation. I won't spend any time here because we'll go into details with each of them. And we may not have time to go through each of these, but I want to stop having me talk and get a sense from you after we've gone through this first one, if this way in which we're presenting it will be helpful, and if we can do some immediate tweaks to make it more helpful. So exploration and design is the first phase, and for many of the LIPs, we have done this work. That's not to say that we won't need to come back to it as we get a better sense of our intervention in order to explore and redesign with new stakeholders if necessary. But a lot of the work we've done through the deliberative forums and community meetings and the information provided from projects 1 and 2 have informed this, which has helped us to land on our foundational structure for the LIPs, the core teams many of us have, to be clear about the need in the community, identify the populations that we're working with, and to consider the evidence base that might address those needs. So that much of this work in this first checklist on the next page is work that you may feel as if you've done. The way in which you might use this exploration and design checklist is to just go back and reflect on, are there pieces we have missed? Is there something more we need to do? And in some cases, you might say, actually, there's some things on this checklist that we've done and we think are very, very important that should be added. So we're very open to that feedback, too. So I'm going to pause again there and just see if there are questions people have about, again, the format of this, but also your sense of this exploration and design stage or the stages overall. So back to open mic time.
So if you want to ask any question, please just raise your hand, or Ginny, there you go.
Thank you. So this is Jeannie. Thank you very much, Kathy, for this. I'm looking at the checklist that's in place now. It's just a simple question. I'm not sure I totally understand this, because you've got the enumerated points 1 to 6, and I guess this is suggestions about what we might be doing. If you could just talk me through the checklist a little bit, because I don't understand exactly what the list is underneath, for instance, that says, you know, need an agency and so on. So I'm shutting up.
That's okay, and actually it's a bit of a formatting thing. I think check whether each is in place, partially in place, not yet, should probably go under the numbered list. The numbered list is just so closer to the checklist itself. The numbered list is just a list, and it comes partly from our LIP implementation guide. Other things that we indicated in the implementation guide were things that needed to be done in a broad sense. The checklist is a much more specific. Let's see. we haven't, these are things to think in general, have we done them? So form the implementation team or repurpose it or expand the current group. So that's a more general thing to think about. It's not necessarily checklisty. You may say, actually, that would be good to have a checklist for places in the checklist. So these are more of the getting the right people in the room and the LIP infrastructure pieces. The things in the checklist are a bit more specific, but I could see that we could actually incorporate some of those right into the checklist as well. Does that answer your question, Jeannie? Or
no. Am I still? Can you hear me? Yeah, I have to see if I'm unmuted. Oh yeah, sorry. No, Kathy, I'm sorry. I'm afraid it doesn't. So I'm still having. So if I understand what you said that for each of the numbered list, we could also check off in place, partially, or not yet. And then, so then what is the list on?
It's more of a formatting thing, Jeannie, and it's how this is just like hot off the presses and not fully formed yet.
Okay.
I'm thinking we should put the in place, partially in place, not yet, next to those questions too. And they are more the things that we have said in the LIP implementation guide, so the previous guide, that needed to be done to actually get your LIP in place, for example. So I need to go back to the LIP Advisory Committee, and we need to actually reformat this so that those are actually made into the part of the checklist.
Okay.
This is the hazard, but also the benefit of putting something out there that's still a work in progress. We didn't want to delay because we know people are keen for this, but we hope there's some tolerance for the free-form nature of this, which is, we had indicated we'd try to get it finalized by Friday. So apologize for that lack of clarity. Any other questions?
Can I just say it's not a question, it's just a comment that maybe for the next iteration, I actually really like the enumerated list. That's very clear. I just didn't understand the other list in there. So that's all.
Just to follow up on that, perhaps we should number the items. Would that be something like, as well as those ones that are enumerated, perhaps all of the things in the checklist should have a number?
Or just to understand that there are subcategories and that they relate also to the list. I guess it's the relationship that's less clear to me, and I'm not sure if the understanding would be that your expectation would be that every one of these need to be in place for the process to be completely complete.
Well, and I think that's a good point you raised, because in the presentation I talked too about the contextual nature of some of these items. First, these are things that are recommended, again, coming from the literature around implementation and those other fields that help with implementation. Sometimes you might have a very good reason for not doing one of them, but what this raises for you is the need to actually have a conversation about whether or not all of these are appropriate or helpful in your context. And if you decide some things aren't, that at least you've been thoughtful about that, as opposed to not attending to whether or not they're needed. Any other questions here? Whoops. That's a nice picture, Sarah. So we will immediately after this do some tidying up on the placement of the text and then clarify what those first questions are, or those first bulleted listed. So similar format for this. We provide an overview from the literature on what this phase is all about. And I'm just trying to see, Jimmy and Will, is Will on the call? No, not even. Some of this, again, links to your comment, Jeannie, and we need to make this a little more clear about what's in the list and what isn't. So I won't go into detail on this, but just encourage you to have a look at that. So again, it's a bit of an overview of those drivers that I talked about in the presentation. So this is just for information and background information. It isn't the bulleted list at this point. It's to help you understand the list, the bulleted section, the checklist. So this phase is really about assessment of community and organizational readiness. And I know that at this point, Sarah and Jen have not had a chance to really put this into the form of a, well, maybe there is a bit of a checklist, but then this is just the overview of it, and some of this is built into the checklist that comes below. Some of it is definitely not amenable to a checklist, but it's, for example, this is describing the 9 stages of community readiness, and under it there are strategies for assessing that. So this is not the checklist again. So as you can see here, this is an example of where it's less a checklist and more of an interview with key stakeholders, key informants. And we had some questions about who the key informants were and being specific about that. But we want to emphasize here too, depending on your context and your intervention, the key informants, specific key informants will be different. And so these are people in the community, administrators within agencies or government that really will have a stake in the intervention and be involved in the implementation of it. So the assessment of community readiness is more of an interview than a checklist. Again, to help with assessing capacity and community readiness, this is where assessment of the implementation drivers, which I talked about a little bit before and are discussed in more detail in the front part of this section, are something that you would move through and just as a core team talk about whether the changes that are needed to implement your intervention are in place. And I can see as I read this now with new eyes, fresh eyes on it, that there's a bit of work needed to make it more usable by you, everyone here. And I want to assure you we're not expecting that you're going to start using this immediately, but what we wanted to do by talking at this stage was to give you a broad frame for the considerations that are valuable when implementing an intervention. I'm looking at the time, and we have 10 minutes left. So the guide takes a similar approach to each of these stages, giving background and then a checklist or guidance in how to assess readiness for this certain stage or what needs to be in place for a certain stage. So I don't think it's as much value to go through it in detail unless other people want me to. So I'm happy to stop here and again ask for questions or comments. One thing that Ginny, Will and Galen and I have started to talk about is, again, I go back to the webinar where we talked about the limitations of guides. We will never have everything that you need within one document. We're providing a high-level frame for the key considerations for implementation of an intervention. But really the most important way that we're going to support each other in moving these interventions forward is by building in some facilitated and supportive discussions about what's working, what's not, as we go, and using these stages and the checklists within it to help our conversations about, to aid correcting the course we're taking within the interventions as we go. Again, I'll pause for questions or comments.
So anybody has any questions for Kathy or Virginia? Just raise your hand, or you can ask it in the question box.
I also know that there are likely people on this call who are as experienced as any of us in implementing interventions, so we hope to learn from you. We've just tried to consolidate information into this guide, but that's a big part of us all getting better at this, is making sure we draw on the internal expertise as well. Ginny, I think we've scared everybody into silence.
No, Kathy, it's actually, it's just, it's very straightforward. And I think maybe once we start using it, we might start to have some questions, but I think it makes a lot of sense, and it's structured like an easy to use tool, so that's what it is.
Okay, it's not being afraid, it's just there's some level of resonance with what you...
Exactly, yeah.
Jeannie has a question.
So I want to echo it. It does look like it's very helpful, and I like the fact that you provided a lot of links to existing resources and so on. So the question I had was, it seems to me that we're kind of at that initial exploratory stage, and when I think about trying to get to stage, whatever it is, like full implementation, by the spring, I guess I'm just a little bit worried. And for instance, one of the things that you said was, you know, the stages that is most neglected is the one about capacity, the capacity and drivers, I guess, making sure that all those things are in place. So I guess you did say that this is a guide, but if you could just address how realistic it is that we could get to a spring implementation if we follow the guide.
And I mean, I know that we've taken on a gigantic task in this impact program. Nobody will deny that we've been ambitious, and yet I think we need to be cognizant of the fact that we are, I think full implementation is a bit of a something we need to be cautious around, and we may get to what's defined as full implementation in 2017. We're going to continue to evaluate up until the end of 2017-ish, and I think if we're really keeping our eye on sustainability and addressing needs, I don't think we should put pressure on ourselves to feel like we need to get to that stage by, for example, a deadline up the spring. But I think having some elements of an intervention implemented by then, and it may be your governance structure and your the initial foundational work that needs to go into it, knowing that that will provide you with the leverage to move forward into more complete implementation. I think the stage 3 initial implementation piece is probably where many of us will be in the spring. I wouldn't put a timeline on saying full implementation by that time for sure. Having said that, I also know that we have to be very cognizant all along the way of what is feasible, and that's why so much time needs to be spent on that capacity and readiness assessment. To really go from our grand ideas of what's possible and what's ideal to what's feasible with the resources we have in community. And then that will make implementation, initial and full, much more attainable. Did that answer your question, Jeannie, or not?
That's helpful. Yeah. And it's I do want to say it is helpful to point out some tendencies, like for us to skip from this to this, and so it slows us down at appropriate times to see the stages.
And it's, as I said too, these are iterative, and I really do think that, for example, in Alberta, when we get we're having another deliberative forum in the fall, in November, to get more meat on the bones of what we're talking about as our intervention, we may realize we need to go back to some design elements and bring in other stakeholders because of what we're being encouraged to implement through our community consultation. And so it slows us down, and it ensures that we don't rush through the steps in a linear way, but think about them in a way that is with an eye to making sure all the right people are around the table to get to a sustainable intervention. Next steps for us, Jeannie, Will, Gowan, myself, and then we pull in a coordinator from time to time to just do some, I'll call it pressure testing on the ideas, is to tidy this up, to do some of the things that Jeannie has pointed out would help to clarify the checklist component. And to also welcome your feedback even after this. You should now, this is, I don't know, Sarah, if this has been shared on Portage in a public place, but those of you on this call, I would welcome your feedback, knowing that we're already going to do some tidying up, so less about the formatting, more about any glaring gaps that you see that would be helpful to fill.
It's the guide is available on the LIP implementation committee, but I will work on it tomorrow. I didn't have any chance to work on it since I came back on Tuesday, so I will work on it, and then sorry, I'll circulate an email to all the LIP coordinators to get their input.
Any other suggestions from people in terms of those next steps that we've outlined? Aiming for the end of this week, early next week, to have a tidier draft ready. Jenny, do you have anything to add in the last minute here?
No, thank you. No, I was muted, but now Sarah's unmuted me. No, I have nothing to add, so that was worth unmuting for.
Any thoughts? No. Okay.
No, I think it's. I think that the points. I think what both Simone and Jeannie said is really important. One is that this should be reflecting what people have been doing, particularly at the PI level with the extensive experience. So it's kind of about helping to have some consistency around the messages from experienced researchers to supporting LIP coordinators and so on. And I think the second thing I thought when Jeannie was speaking too is just that I don't think the intent, and Kathy said this, the intent is not to require people to follow the guide before they implement it. We know that that's not how impact works. And so people will be well down the implementation trail already, and the guide may just help people to identify where they could strengthen their implementation, can check how's it going. So even if people are well down the track, hopefully this guide's helpful.
Thank you, everybody. I hope we have continued conversations about this, and that's one thing that we do need to build in is the time to talk about what's working, what's not, and that is a logistical piece that still needs to be worked through. It doesn't add too much more to people's plates, knowing that the coordinators already meet and might try to join those meetings, that sort of thing.
Thank you, Kathy, for the presentation and being here today. And I would like also to thank all the, sorry, I'm sick, so my voice is letting me down slowly. And I'd like to thank the LIP coordinators and the PIs that joined us today for the presentation. I hope it was useful. And I'll circulate the guide as soon as possible. Thank you.
Thanks, guys. Bye-bye.
Bye.
Bye.